continue?
Yes,
You
continue.
are audible.
Yes.
So there is also a night mode in our phone which reduces the blue light, thus it increases the melatonin and you can easily sleep off. So this night mode is basically to reduce the blue light so that you can have the hormonal effect on your mind and you can sleep. So this night mode can be used because they reduces more of blue light. Now then comes polarized glasses or glares. You know, this is what we all are using, but we need to understand what are these polarized glasses. Now, if you look at this, whenever there's too much of light, there's so much of glare that you just can't look into the sun, even, especially when you are going to a seaside or when you're going to mountains where there is snow. Now, what happens is these polarized glasses are like vertical blinds. So only the vertical light will come in. All the horizontal lights will not come in these polarized glasses. So all these polarized glasses are especially useful, especially in open areas where there's a lot of reflection, and reflection is coming from different angles and different horizontal surfaces. So just think of it as a vertical blind, and only the vertical light is coming into your eyes, so your eyes are more soothing and all the other reflections are cut off. Now look at this seaside. Once you wear these polarized glasses, you are very comfortable, you are able to see clearly, you are able to see without any glare. Now comes the most important thing, is the computers, the digital devices, and the eye strain. Now friends, we need to understand that there is something called computer vision syndrome. Most of us are glued to the computer or to our phones. Now what does it do? It causes you red eyes, it causes you neck pain, blurred vision, difficulty in refocusing, or dry, irritated eyes and headaches. So all these things come up, and this is a whole system of symptoms which we call as computer vision syndrome. Now if you look at a paper and you see a font, a letter, the paper is going to have a proper resolution which is not going to change, but in a computer there is actual pixelation which our photoreceptors can actually make out. So there is a more in a screen there is a poor image quality and an increased visual demand, which we can actually analyze by magnifying the photograph on a computer. Now we need to understand that we should use proper prescription glasses for our myopia, for our cylindrical lenses, and for presbyopia, because if we are using proper glasses, we'll be having better work performance and better quality of life. Now, another important thing is that once we see the screen, our blink rate reduces. Increased usage leads to reduction in blinks by around 6 to 8 times per minute. So blink, blink, blink. This is what we say, that when you are too much on the screen, do blink. So what are the causes of digital eye strain? Poor lighting, glare on your screen, improper viewing distances. Now that is very important. Then proper seating posture. You should not have any uncorrected vision problems. If you are wearing glasses, please wear them so that you can see clearly without causing strain to your eyes. So the extent of digital strain depends on the level of your visual abilities, the amount of time you spend, your vision problems, your eye coordination abilities, and the aging changes, especially presbyopia. So there is an important, American Optometry Association formula that they give to prevent digital strain, which says that take a 20-second break every 20 minutes. Look at something 20 feet away, which means that हर 20 मिनट बाद आपको 20 सेकंड के लिए रेस्ट लेना है, और उस रेस्ट में आपको दूर देखना है. You have to look far off so that your muscles are relaxed, you are looking clearly, and because when you are doing near work, your muscles are actually at a lot of strain. So once you look far off, your muscles will be relaxed, you will have less of digital eye strain. So this is a formula that you should give to every person who comes to your clinic and you say that I have lots of headache and I have a screen time of 8 to 10 hours. And nowadays we see a lot of techies coming to us with these kind of problems. At least 4 or 5 patients come every day with digital eye strain and a different set of symptoms. Some have headache, some have eye strain, some say there is dryness, some are irritated, and then they say, sir, I can't work without it, my job is like this. So I tell them that that your 10 hours of screen time is important, but once you leave the screen, you should be away from your phone. Don't be glued to your phone. Do outdoor activities, do proper exercises, sit properly, so that you do not have this digital eye strain, and that you use it only for your professional needs, and in your personal time, just be away from the digital screen. Now, font size is again very important, especially when we are above 40. Sometimes we want to do away with our glasses. We don't want our glasses and we do not have our glasses. So increase the font size, your eyes will be more relaxed. And this is again one feature in iPhone and various other phones, is that you can actually fix the time that your child can use the screen. So once that screen time is over, the internet is not going to work and the child is not going to see. So this is what we can do for our children, especially if we know that we have to give them the phone also, and they are also it is going to they are going to actually work on those without telling us. So this is something that we need to be very careful. Now, blink rate, as I already said, you have to minimize your chances of developing dry eye. Blink as much as you can. Now, there are some medications that we usually prescribe for people who work too much on screens, like Hyalo tears, Refresh tears. Lots of companies have come up, but usually they provide lubrication to the eye, they soothe the eye is more comfortable, and people who are using screens, they should use it at least once in 2 to 3 hours. So what next? Most of the people use it is usually temporary. It usually declines after stopping computer work or use of digital devices. So we need to address this problem, and the symptoms will continue to recur if we continue to use our eyes and abuse our eyes. Now, the third part of my talk is again very, very important. What is the correct sitting posture? Now, this is what is the exact correct sitting posture. In fact, when we see our patients, then also we need to understand that our chair, our table, our computer screen, nowadays a lot of us are working on EMR, so we are also glued to the screen. The screen eye level should be 40 to 75 centimeters, almost horizontal. Then the padding in front of keyboard, the way your hands should be there, the way your thighs should be there. We need to be careful, because otherwise we either have a neck strain or a back strain. And once we do not take care of them, then you know how much problems that we can have, especially with the growing age. So all these things you should avoid. You should avoid turtling. You should hold your mouse not too far, not too near. You should have a good chair. Invest in a good chair. Now, good chair is like you have lots of that you need to invest. Now,
all are requested to kindly mute yourself.
Okay, sir, may I start?
No, so you can start. You can start.
So all these chairs and the way you are sitting is very, very important. You can look that the first part is the right one, and the other 3 photographs you have to just avoid it, because you feel like doing it in a very lazy way, but these are actually very, very harmful for your neck and your back. So again, a 20-20 rule: take a 20-second break every 20 minutes, look 20 feet away. So now one more thing that when I was preparing this talk, I could make get in my research, was that the kids use digital devices more than their parents think. Their parents think that my child is using only more than 3 hours per day. Only 40% of parents say, but 83% of the kids are actually using it. So too much screen can lead to digital eye strain, and believe me, this screen time and this COVID era has actually caused a myopic pandemic or epidemic, whatever you want to say. But there is a myopic epidemic, and there are problems which I am not discussing, which is beyond the scope of this presentation, as to what will happen. Myopia is not just the glasses that you are going to wear or the power of the glasses that you are going to wear. When your eyeball stretches too much, there are a lot of problems which can come in the retinal detachments, retinal neovascular membranes, and lots of things. So those all problems that we as retina specialists or eye surgeons see, that is because of high myopia. So we need to be very careful, especially the pediatricians and the ophthalmologist. All the children who come to you, you have to tell them that the recreational screen time has to be reduced. In case their power is increasing, they need to consult an ophthalmologist so that he can prescribe atropine drops or myopia management glasses, or tell them the do's and don'ts so that the power does not increase. These again, I have, as I already told, that this is the correct posture that you need to have. So, this is my father-in-law. He is always on the screen and his cervical spine cries. And you see how, especially in the old age, you are so much glued to the phones. It is not bad to see the phone, but you need to see it properly. So what I got for him is this thing from Amazon, so that he can actually put his phone on the table and keep on looking at it. So that is how he can improve the posture. Again, another device that I got, which especially I kept it for him, is that he can use it without disturbing his neck spine or a back spine and keep on enjoying the screen as well. So now, friends, this is just a different thing, but I would like to tell you that we need all those people who are on the screens should do cervical exercises every day. And cervical exercises, just 2 minutes I'll take. They are of three types. First is the free movements, then is the stretching, and finally the strengthening. So I've got a small video what you all should do. So you need to do free movement. The cervical spine should move freely, 5 to 10 steps. All these spines, you can see this thing. You can see how the hands are moving, how the legs are moving, how the cervical spine, the back spine, the free movements are very important. So first part of cervical exercise is the free movements. The second part, which is important, is the stretching. You need to stretch your neck muscles. First on the lateral side, and then on the frontal side.
Everybody is requested to keep yourself mute.
So friends, any muscle, any exercise, the first is the free movement, the second is the stretching. You need to stretch your muscles, and that is not enough. You need to strengthen them also. So strengthening of our neck muscles, though this is not going to take too much of your time, you can just do it for 5 minutes in the morning and maybe 5 minutes in the evening, and that actually will work wonders, especially if you are working on your microscopes, if you are too much on the screen, if you feel that your neck is paining because of too much phone that you are using. So do all these things which will help your spine better. This kind of strengthening, you need to push your neck against your arm so that the muscles are used first on the lateral side, then on the frontal side, and finally on the back. So you try and do a good research on all these exercises, and the ergonomics about this is that once you do it, you will feel the difference, and you should do it for at least a week or 10 days before you start finding a difference. There are a lot of people who have a slouching back, or the neck spine is there, and they come up with lots of problems. And most of these, spasms also cause headache. So a lot of patients who come up with headache are because of the tight spine and the tight neck muscles, which we usually encounter in patients who work more on digital screens. So I'll be ending my talk, but with this beautiful quote by Swami Vivekananda, which he had rightly said that anything in excess is a bad habit. You should do most of the things in moderation, because anything once you do in excess, you are going to, the natural adaptation, the natural way your body is actually inclined to do all those things will go bad, and then you will suffer. So finally, dear friends, we all care for you. We want you to be healthy and happy. So please adopt better habits, because they will go a long way. Thank you. So just a short word that we have got something new in ophthalmology with us for removal of glasses. That's our team, and we have all the eye specialties under one roof. Thank you so much.
Thank you so much, Dr. Ashish. A few points I just wanted to emphasize since हमारे group पे इस समय ophthalmologist भी बहुत सारे I can see Dr. Taneja also there. Please, a request to everyone, please invest in a very good pair of glasses with anti-reflective coating and blue cut glasses, blue coating glasses while using the computer screen, and please try to follow that 20-20 rule. वो तो बहुत ज़्यादा ज़रूरी है for whoever is using computers and laptops and mobile phones. And all the phones these days have a screen time. We can always set our screen time, and which will be essential not just for children as well as for us also. Because we also tend to keep scrolling the Insta reels and YouTube, we keep watching. So we should also be very particular about this. And a few words of wisdom from our INED President, sir, Dr. P.JAIN, sir.
Thank you, Dr. Kavita. And congratulations, Dr. Pawan, Dr. Ashish, and Dr. Kavita. That first time the attendance has crossed this 100 marks. So big clap for all of you.
Thank you,
and
sir.
Secondly, the topic is really सबके लिए बहुत ज़रूरी भी है ये जानना, और बच्चों में तो खैर ये बहुत ही ज़्यादा ज़रूरी है. And nowadays we people are finding it very difficult to keep all these limits of screen. Especially the parents, they are not also trying to understand. Kids are kids, they will never try to understand all these things. But parents, the सबसे जो बुरी बात है कि पेरेंट्स भी समझने की कोशिश नहीं कर रहे हैं, और सिर्फ आंखों से नहीं, स्क्रीन की वजह से ऑर्थोपेडिक प्रॉब्लम, स्पाइन की प्रॉब्लम, और फिर उसके बाद साइकोलॉजिकल इश्यूज. देयर इज अ लॉन्ग लिस्ट because of this screen, especially in kids, and the adults have a different problem. So this is really, I congratulate Dr. Ashish for putting up such short and informative talk. Thank you, Dr. Ashish. Thank you very much.
I hope you all must have liked it, but I tried to keep it short and simple.
Ashish, you said near work. Would you like to differentiate between near work while reading and near work while watching computer or phone?
Sir,
Is
near work is near work, whether you read or whether you do it on screen. In my personal experience, I remember that when I was in 10th class, my power was -1, and when I crossed my 12th, my power was -4. So if I actually analyze it in my kids, that one of my kid is a very avid reader, his power increased like anything. So near work is bad, whether it is reading or computer screen. Computer screen is even worse. So we have to do it in moderation. I see kids who read too much and their spectacle power also increases too much. So both of them are bad, but try to do it in moderation.
I think if you are reading books, I tell students that when I ask them whether you watch TV or watch phone, they say we don't watch any phones. And after some times, you are able to extract them that they watch up to 5 hours per day. And then they say that, but we get our homework on phone and we have to do on our phone. But I tell them that you purchase books. Whether the books are not available in the market, books will be better than this computer or phones.
You're absolutely right, sir. Books are better than computers. That's absolutely right. But important is, I say that recreational near time should be reduced. In non-recreational, everybody is under stress. They have to study, so we can't, ask our children, especially in 10th class, not to study for their competitive exams or whatever. So I say that recreational time, seeing reels, we all are actually so fond of, there's so much of content on the screen that you can spend hours and hours looking at it without, actually gaining anything.
The problem today is that most of the time, even the reading also, the kids are doing on screen itself, rather than having a hard copy of a book. Because when you are reading a book, probably your blinking rate is good as compared to the screen. So I think that is also a problem. Many a time yes.
I had said, shown in one of my slide that in the computer screen, there is an actual movement of the pixelated words, while in the reading, it is actually fixed. So the computer screen is actually worse than the reading a book, as you had rightly said. So I totally agree.
आशीष आशीष हेलो
हाँ जी
Yes,
सर,
sir.
बताइए।
Yes, sir. Go ahead.
ये एक बार से फिर से बताना डिस्टेंस ऑफ द कंप्यूटर स्क्रीन फ्रॉम द आईज हाउ मच शुड बी द डिस्टेंस
Sir, it should be around 45 to 60 centimeters.
ओके ड्यूरिंग रीडिंग आल्सो
Sir, yes, basically it should not strain your eyes.
ओके
You should not slouch. You should not have a turtling effect. It's a combination of everything. You should take care of your neck, your screen. You should not move this thing. Overall, the eyes should be relaxed. So you can't be too close to the screen.
ठीक थैंक यू नाइस टॉक
Thank you, sir.
धीरेंद्र भाई, अगर आप फोन पे देख रहे हैं फिर तो आपको जाना पड़ेगा नजदीक। अगर आप कंप्यूटर स्क्रीन पे देख रहे हैं तो आप 2 फुट 2.5 फुट से भी देख सकते हैं। फुल स्क्रीन पे आप कुछ देख रहे हैं तो 5 फुट की दूरी से भी, आप अगर आपका 14 इंच की इसके साइज है तो 5-6 फुट की दूरी से भी देख सकते हैं। लेकिन फोन में आपको आगे आना ही पड़ेगा, 40 सेंटीमीटर पे ही दिखेगा वो।
Good evening, Dr. Ashish. I have a question. For pregnant lady, what are the recommendations for watching screen at one time, working or watching? Are there any specific recommendations?
I don't think so.
It stands same for everyone, no, because there is some degree of corneal edema in pregnancy. So that is why I was asking you.
Ma'am, you need to take care of dry eyes. Usually because of the hormonal changes, there are little more of dry eyes in pregnant females. And if they watch too much of screen, then that thing can be exacerbated. And whatever you're saying about cornea, once the dryness increases, the corneal surface becomes bad, and you have more irritated eyes. So I would say that yes, in moderation they should do, and the watching screen because of the hormonal changes will cause more of dry eye. That is all that is there.
Thank you, sir.
Apart from this problem of a screen on eyes itself, probably the posture also make a difference during the pregnancy because they are already having a exaggerated lordosis. So I think that is also one of the concern which need to be addressed.
Very right, sir.
सर प्रेगनेंसी में भी और सर पोस्टमार्टम पीरियड में भी अगर कोई लेडी ज्यादा पढ़ती है, इवन फोन नहीं देखती, पढ़ती है, तो भी उसको दिक्कत होती है। तो जब तक बच्चा आपका फीडिंग आप करवा रहे हो तो ज्यादा नहीं, मतलब पढ़ने लिखने का काम ज्यादा नहीं करना चाहिए। आप सुन सकते हो, लेट के आप सुन सकते हो।
अरे साहब, ये तो लड़कियां तो आजकल लेबर रूम से ओटी से बाहर आते ही सबसे पहले मोबाइल फोन उठा के बात करती हैं, स्टेटस अपडेट करती हैं। Anyhow.
But sir, it is written in books also. For 2 weeks, it takes time for eyes to adapt. Even reading a book also causes so much of strain. After 2 weeks, the changes starts reverting. Then that headache or pressure on the eyes is not there.
Right.
सर थोड़ी ना स्क्लीरल थिनिंग हो जाती है, उसकी वजह से थोड़ा सा नंबर में भी अल्टर्ड हो जाता है प्रेगनेंसी में और पोस्टमार्टम में। उसमें मतलब कि अगर आपको दिक्कत हो रही है तो दोबारा से आप नंबर चेक करवा सकते हैं। थोड़ा बहुत अल्ट्रेशन होती है, वो 1 साल में 1.5 साल में फिर प्री प्रेगनेंसी के लेवल पे रिफ्लेक्शन आएगी आपकी।
True.
So, any other question? Anybody can unmute himself or herself and ask the question from Dr. Ashish.
So there is one more topic which I feel that we should cover is the ergonomics part of it. I just talked a very little thing about it, but we can all have some other scheduled meeting where we can talk about our experience with how we deal with the ergonomics of screen and setting and all those things.
Perfect.
That is a nice idea, Ashish. We will definitely, Dr. Pawan, just note it down so that in future
we'll do that.
We can do an interactive session along with the orthopedician also.
Yes.
For this thing. That will be much better.
सर एक मैं अपने पेशेंट्स को बताता हूँ, जैसे जो लोग सारा दिन कंप्यूटर पे काम करते हैं 8-8 घंटे 10-10 घंटे के, हर 1 घंटे बाद आपको 5 मिनट उठ के टहलना भी है। ताकि आपकी मांसपेशियां जो उसी स्थिति में बैठे बैठे जकड़ गई हैं, लेग्स में पुलिंग हो गई है, 50% ब्लड वैसे ही होता है। अब बैठे हैं ऐसे पोस्चर पे तो आप और लेग्स में खून ज्यादा इकट्ठा हो जाता है, तो आप थोड़ा बहुत चले फिरेंगे तो खून वापस सर्कुलेशन में आएगा, मांसपेशियों में मांसपेशियां भी ठीक होंगी आपकी। तो
Sir,
5-7 का ब्रेक अगर 1 घंटे बाद लिया जाए तो वो भी अच्छा है, बिसाइड्स 20-20 रूल जो है ना उसके अलावा।
absolutely right. Even when I had a back problem, my orthopedician said that the sitting for more than half an hour, 45 minutes in one position will cause so much strain on your spine that you just can't imagine. So the best part is that once you're sitting, just get up for even a minute and then sit again. So that that sitting causes a lot of pressure on the spine and all your muscles become spasmodic. So you're absolutely right for that. You just need to get up.
बहुत बढ़िया आपका आशीष, बहुत बढ़िया आपने प्रेजेंटेशन दी है, लेकिन आप कॉन्फ्रेंस में दिखाई नहीं दिए 4 दिन दिल्ली में।
मैं वहां पे था सर, मेरी 4-5 प्रेजेंटेशन थी, बट समाउ
चलो बाई चांस है कि दिखे नहीं।
सर 12,000 लोग थे वहां। थोड़ा चलो सर, थैंक
12,000 लोग थे, 24-25 साल थे।
यू।
Thank you,
Any other
thank you
question?
all of you for attending the session. Dr. Pawan, it's over to you for the final comments and to vote of thanks and to close the session.
Thank you, Dr. Ashish Lall, for a wonderful presentation. It was really a masterly presentation, and it was of interest to almost every attendee. We have lots of question, and we had a wonderful interaction also. And today, our efforts to get more and more number of attendees has really fructified, and we got more than 100 attendees today. So all the kudos to our team, and I would request every attendee to please join every Thursday 8:30 p.m. On the same link, and we'll have more and more wonderful topics and wonderful speakers also. Thank you, everyone. And
Thank you so much.
Dr. Pawan and Dr. Kavita, we are getting again this request to put all these recordings on YouTube. So Dr. Kavita, you are already doing it. I think now it's time that we should put all the recordings of this Thursday academic program on IMA YouTube channel.
yeah,
Sir, I am Dr.
we'll try.
Anandamurthy.
We will surely do it.
Sir, I
Thank
am
you.
Dr. Anandamurthy.
Yeah,
Hello.
please, sir.
One submission, sir, please. What is the routine in daily life? There is a TV screens and cinema, OTT cinemas, everything is there. What are the precautions that has to be taken for the kids, children?
Dr.
In the
Ashish.
TV screens and movies, everything.
Sir, as I already had pointed out in my slide that we should avoid screens, should be 0 for less than 2 years, and 2 to 4 years it should be around 1 hour per day, and from 4 to 6 years it should be around 1.5 hours. So we should try and reduce the recreational time, whether we are using the screen or the laptop or the phone for our children. And the approximate thing is that below 2 years it should be a big no. From 2 to 6 years it should be something from half an hour to 1 hour, and above 6 years it should be around 1.5 hours per day. So that is the usual guidelines that are given for use of screen for recreational purposes.
Thank you, sir.
Hello, Dr. Ashish, sir.
Hello.
Hello, sir.
Yeah,
Hi,
please.
I'm Dr. Ashish. It was a very nice and nicely summarized talk by you. And I met you in conference AOS. You gave talk on anti-VEGF injections. As I heard that talk. It was very wonderful, sir.
Thank you.
It's always pleasure to listen to you, sir.
Thank you.
It was a very nice summarized talk for everyone, including not only for ophthalmologists, but we all doctors and medical fraternity, and for our children, because the next generation is suffering from a pandemic like digital India. Because whenever a patient came to my OPD and they say कि सर आप समझाओ बच्चे को फोन नहीं यूज करना, तो मेरे मुंह से कई बार निकल जाता है कि बच्चा मेरा थोड़ी है। तो वो कई बार पेरेंट्स सोचते हैं कि ये क्या बोल दिया डॉक्टर साहब ने। तो मैं उन मम्मियों को ये समझना चाहता हूँ कि अपने बच्चे को ना वो कहते हैं ना, चुप हो जा बेटा, ये ले फोन ले ले, चुप हो जा। मतलब वो फोन देके चुप कराना चाहती है उनको, और वो शॉपिंग करने में बिजी है मान लो, तो वो उनका तरीका गलत है। दे आर नॉट मम्मी, दे आर मम्मीज। मम्मीज, MUMMI पर, मतलब लाइक वो अपने बच्चे को खुद बिगाड़ती हैं, और डॉक्टर को, आई डॉक्टर को ये समझती हैं कि ये धमकाएगा तभी हम मतलब बच्चा मानेगा। तो दैट्स वाई सर, मतलब मुझे ये लगता है कि सबको ये कहना चाहिए कि भाई तुम्हारा बच्चा, तुम समझाओ इसको, फोन तो तुमने दिया इसको। सैमसंग का फोन 20,000 का आता है, मुझे एक 31 रुपए का फोन लेने के लिए इंटर्नशिप करनी पड़ी थी। इंटर्नशिप की पहली इनकम से मेरा फोन आया था, तो नोकिया का, जिसका जेब के बाहर ऐसे निकला होता था एंटीना। तो हमने अपने पैसों से कमाया है, इनको बच्चों को मिल जाता है। देता कौन है? पेरेंट्स ही देते हैं, बाहर वाला तो कोई देने से रहा। तो सर, इट वॉज वेरी नाइस टॉक, और बहुत बढ़िया सर। ऑलवेज प्लेजर टू लिसन टू यू सर। थैंक यू सो मच।
आप ये भी बोला करो कि मेरी तरह क्रिकेट
course.
खेल रहे हैं, टेबल टेनिस खेल रहे हैं, बैडमिंटन खेल रहे हैं।
नहीं, Dr. Vikas has a point. Definitely, this is the time that we should make other people, even the community also and society also, aware about the effect of a screen, not only on eyes but also on the your spine and your uh, everything. So this is the right time that we should try to do this also. Thank you.
सर वो क्रांतिवीर मूवी में एक डायलॉग था नाना पाटेकर का, कि आज तुम्हें बचाऊंगा, कल को कौन बचाएगा, तेरी माँ को। तो मैं अपने पेरेंट्स को, पेशेंट्स के मदर को बोल देता हूँ कि आज तो मैं बोल दूंगा तुम्हारे कहने से कि बेटा फोन मत यूज करो, लेकिन मैं इसको 24 घंटे इसको निगरानी थोड़ी करूंगा तुम्हारे घर आके। तो मैं तो बोल देता हूँ सर ऐसे, लाइक।
I would request Dr. Ashish to make a short video of around 1 to 2 minutes, because our attention span is usually that much only. A short video of 2 minutes, guiding our parents or our patients or general public about the harms of screen time, and how to avoid that strain on our eyes.
And a write-up also, Ashish, a write-up of also in about 2 pages.
I hope you guys liked it.
Yeah.
Thank
We
you, sir.
really liked it very much, sir. Very much. Even being ophthalmologist, I liked it very much, sir.
Thank you, sir.
2020 rule, correct posture, and ambient twilight, sports activities. We should all encourage our children to indulge in sports activities. जब शरीर मजबूत होगा तो माइंड भी बहुत सुदृढ़ होगा सर, सीधी सी बात ये। जी सर।
So thank you very much. Thanks everyone, and good night.
Thank you, sir.
Thank you, Dr. Pawan sir. Thank you.
Right, and hope you will join again on next Thursday and every Thursday. Thank you so much.
Thank you, Dr. P.JAIN sir.
Bye bye. Good night. Jai Hind.
Good night, sir.
Good night.
Good night, sir. Good night. Jai Hind, Dr. Taneja sir.